Okay. So diarrhea, flow or discharge. So we talked about the medical terms, or we talked about the word parts up front. So at the bottom part is the medical terms, and I just put each one of those into a term so y'all can kind of understand. You see, I broke it down and I highlighted exactly what it means. So did everything make sense right there when I put it with the word parts and the medical terms?
Okay. Yes.
So no questions about this?
No.
Okay. So don't throw your packets away either, because this stuff that you can like keep forever, go back, refer to, and things like this. So kind of keep this, and you can always go back and refer to. Okay, so we're talking about word roots and word root and combining forms. So the first word root and combining form, well, at the top you see where we're talking about your spinal cord, your muscle, your bone, your nerves, and your joints. So all of these I'm sure make sense too. Just out of the top of my head, osteo. Sure y'all heard of osteoporosis. And it talks about your bones. So how you see that even if you've never saw the word before, if you have the basic foundation and understanding of medical terminology, you don't have to remember everything. You can just automatically look at it and know. So you know, osteo means bone. You're gonna know arthro means joint, arthritis, or anything like that. So the word root and combining forms. So the first one is gonna be cyan. So cyanosis. Anybody heard of cyanosis before? No. No? Okay. Okay. So just in layman's terms, it says here the blue discoloration of the skin caused by lack of adequate oxygen in the blood. Cyanosis is just like when somebody is maybe suffocating or something like that, where you can't breathe anymore. You know how your body turns a different color. We're darker skinned, so we're not gonna, turn blue because we can't breathe or whatever. So most of the time you're lighter skin or something like that. If your oxygen is somehow cut off, like if you was drowning or something like that, you can't breathe, then you're going to turn blue. So that's what cyanosis is. So leukocyte is like a white blood cell. And leuko means white and cyte means cell. So anytime, whether it's this class, when you get into coding or whatever it is, if you see leuko, you'll know leuko means white. So whatever it is they're talking about, like leukemia, it deals with your white blood cells. Anemia is low. So you can automatically know that leukemia means low white cells. You know how you can put things together. Okay, so everybody got their understanding. We won't have to read all the way through if everybody got the full understanding of what's going on. Okay, so here we talked about suffixes. We talked about how it's an adjective that describes or defines. In medical terminology, many suffixes, meaning pertaining to, are used to change the meaning of a word root into an adjective. So all of these suffixes mean pertaining to. So if you see all of these, you're going to know that this means pertaining to at the end of the word. Okay, so we got prefixes. Everybody know pre means before. So you're going to put this on before the word. So prefixes describing direction, quantity, size, and amount. That's going to be very important to you understanding the basic foundation of the medical terminology. The direction, the quantity, the size, and the amount. So you know how you see ab is away from, negative of, or absent. Okay. That was my favorite one, because you'll see a lot of it that says ab, and you can automatically know, like abnormal. When you see abnormal, there's something negative or something going on or something like that. So a lot of these words apply to like regular everyday stuff too, to kind of figure out some things. So contrasting and confusing prefixes. So a lot of these prefixes look the same, but they are spelled different. Spelling is very, 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 very important in medical terminology. Coding, any kind of administrative work, or anything, especially when you're doing medications. If you're in this field, you already know you can miss one spelling, it can be a different medicine. So spelling is going to be very important to understand if it's a B like boy or D like dog. So I put all of these contrasting and confusing prefixes to show you a lot of the most common medical terms that get mixed up. Okay. So word parts and determining the meaning. Knowing the meaning of the word part often makes it easier to figure out the definition of an unfamiliar term. That's all I've been saying from the beginning of the class. If you know the meaning of the word parts, you're going to automatically be able to figure out what the unfamiliar term is, whether you've saw this word before in your life or not. Okay, so the example down here that I gave was, anybody want to pronounce the word? Anybody want to try? Anybody got it?
Which one we're on?
We're on taking terms apart.
Oh, okay. Woo. Otorhinolaryngology.
Yeah. That's close enough. That's close enough. And that's why I put the definitions in here so you can kind of sound it out. And it says otorhi, like rhino is like the nose. Rhinolaryng, like the larynx. Laryngology.
Okay.
Otorhinolaryngology. So it's talking about your ear, your nose, your throat, and ology is the study of. So you can automatically break that down. It's like, oh, they're talking about your ears, talking about your nose, your throat, and studying. Oh, there must be a doctor that studies your ear, nose, and throat. So a lot of stuff sounded like as well. A lot of things may sound like it start with one letter, but it actually begins with another one, and there's examples. So anybody want to go through the examples? A couple of examples. So it's 3 people. So 2. Everybody take like 2 examples. Yeah, everybody take like 2 examples. Let's go through. And then one person to have one.
Okay. Belatus.
Okay.
Bilema. Gingivitis. Jaundice.
Anybody know what jaundice is?
It's when you had yellow eyes, right?
Yellow eyes, yellow skin.
Okay, yeah.
Do you know what part of the body, or what body part, or what organ that jaundice affects?
Is it the blood cells or
the organ? It's an organ.
eyes?
It's an organ. Your eyes are an organ, but not that one.
The heart?
It's one organ. I'm gonna say, if you see anybody with yellow eyes, yellow skin, and like they say about the baby, liver, exactly.
Yeah.
If you see somebody with that, and like a lot of people who got sclerosis of the liver, who drink a lot and things like that, their eyes are yellow and things like that. So if anybody has jaundice or anything like that, there's automatically something wrong with their liver. Okay, so we won't have to go through all of these, but you see how it may start with an F, or it may it sounds like it starts with the F, but it's really a PH, or it could be a F. That's why the medical dictionary is so important, so you can kind of look up exactly what you're talking about. Okay, so look-alike, sound-alike terms and word parts. So we have ectomy, ostomy, and otomy. So those are going to be very, very, very important, especially on your next step in coding. Especially if you get a general surgery coder that you're coding for, or a physician that does a lot of procedures. So you're going to have to know the automatic difference between ectomy, ostomy, and otomy. So of course we know ectomy means the surgical removal. The ostomy is the creation of the artificial opening, and the otomy means cutting or a surgical incision, just like we're going to cutting too. So anybody know what a fistula is? Those two sound alike. So fissure, and a fistula. Anybody know what a fistula is? No. So what a fistula is, anybody know anybody who's in dialysis? Anybody knows anybody who goes to dialysis? No?
Yes.
Okay, yes. So if you know anybody that goes to dialysis, they're going to have something under their skin that connects them when they go to the dialysis, that drains their blood back and forth. And it's going to be up under their skin. It's like a tube up under your skin, and that's called a fistula. So that's how they clean your blood when you go to the dialysis center, back and forth or whatever. It's the fistula underneath your skin. So let's...
in where blood goes in and out.
Right. That's what a fistula is. It's created under your skin. And you see where it says here the definition is an abnormal passage And the reason it's abnormal because it's created. So it's a created passage. So blood can flow in and out of your body. So it's an abnormal passage, usually between two internal organs or leading from an organ to the surface of the body. And the organ that would be described in here for the dialysis would be what? What organ deals with dialysis?
The liver?
No. What did you say after liver?
Kidney?
Kidneys. That's why you do dialysis, because you have kidney failure.
Mm-hmm.
Y'all with me? Or I lost y'all anywhere? Everybody with me, right?
Yeah.
Okay.
We are.
Okay. So if you got dialysis, then that's an indicator that you have kidney failure. There are 5 stages to kidney failure. Now, this is going to be important. So you're going to have stage 1, 2, 3, 4, 5. And when you get to stage 5, you don't even have to say stage 5 anymore. You just say ESRD. Anybody can tell me just what you're thinking of what ESRD stand for? That's stage 5 of kidney failure. The last stage. Okay. So ESRD is end-stage renal disease. If you see the word renal, that's dealing with your kidneys. So if you see ESRD, that's going to always mean end-stage renal disease. So when you get to the end stage, you don't have to say stage 5 anymore. You can just put those acronyms, ESRD, so we know you have stage 5. So dialysis fistula deals with your kidneys. So the next word is, both of them sound just alike, ileum and ileum, but they are pronounced different and they have different, but they pronounce the same but have different meanings. The first ileum with the E is the last and longest portion of your small intestine. So in your small intestines, that's your ileum with an E. And how I remember it is, ileum is spelled with the E, and E is in the word intestine. So that's how I remember which ileum is which. So the ileum with the I is part of your hip bone. And how I remember that is it has a hip in it. So I try to do little things to help me remember, because a lot of things is hard to retain if you don't study over and over and over. So I try to come up with little acronyms or little reasons or things like that where I can kind of remember what it is. So a laceration and a lesion. What's a laceration?
A cut?
Yeah, a cut. And what would be a lesion? Okay, so a lesion grows. It's kind of like a mole. What was you going to say, Alexis?
Injury.
Okay, so a laceration is like an injury, a cut, a wound, or something like that. But a lesion is something like a mole that grows or something like that, and you don't know what's going on with it. So that's going to be described as a lesion on your skin. Lesion is a laceration is going to be like a cut, and a lesion is a pathological change of the tissue due to disease or injury. And what it can mean by injury is, just like anybody know somebody with keloid skin or anything like that, that can be classified as lesions. And that's from like sometimes injury. If you get your ears pierced, then a keloid skin will grow. If you cut yourself and how your skin is, then your injury will cause a lesion. So mucus and mucus, same pronunciation, 2 different words. The first one with the COUS describes the specialized membranes that line the body cavities. So the COUS, it deals with your cells and what's inside of your body cavity of your cells. The second one is what come out your nose. Okay, so let's see any more look-alike, sound-alike. Let's see. Ologist and ology. So the only difference between those things, the ologist is the person. The specialist, like you're going to see the oncologist, that means you're going to see the cancer doctor. So if I say ology, that just means the study of. So oncology is the study of, and oncologist is the person that's studying. So that's the only difference between the ologist and the ology, is the person and just the thing you're studying. So let's see, the rest of it we kind of skip. Self-explanatory, supination and suppuration, infection and inflammation. Everybody know the difference between an infection and an inflammation. An infection is an invasion of the body. by organisms or disease-producing organisms, and inflammation is when you're swelling up and things like that. So if you ever hear somebody, now this is going to be a term you're going to hear a lot in the medical field, especially if you work with elderly, seniors, the geriatric community. A lot of times they don't say fatigue or tired. They'll use the word malaise. Now, I don't know where it came from, other than here it says it's a French origin. But I don't know why it's used a lot. You see where it says referring to feeling or general discomfort or uneasiness that is often the first indication of an infection or other disease. So a lot of times instead of it saying fatigue or tired, it's going to always usually say malaise, especially if you're dealing with somebody older. Let me see. Okay, so down here you see where your large, small intestines, your ileum, and things like that. So I wanted to give you a little view of that since we were talking about ileums. So basic medical terms to describe disease conditions. So when you hear somebody say, well, this is a sign and symptom of multiple sclerosis. So I wanted to let you know what all of these different definitions are because they're going to be very important to knowing. So a sign is an objective evidence of a disease, such as fever. How they're saying now, if you got a fever, then you probably got corona. So a sign is something that's indicating that you might have the disease. So the fever will be the sign to let us know that you might have corona. So a diagnosis is the identification of a disease. The coronavirus would be the diagnosis. Since the fever is the sign, and we think, because you have a fever, you may have this disease. So the diagnosis is when the doctor is saying, this is what you have. So in coding, when you go to the doctor and the doctor writes your notes out about what you're coming in for, the doctor may write, hey, Anastasia Davis, 24-year-old female comes in coughing, sneezing, wheezing. So as a coder, the only time I will code your coughing, sneezing, and wheezing is if the doctor doesn't know what's going on with you. Because everything that's going on, 9 times out of 10, it has a diagnosis unless you got some rare disease that I ain't never heard of. If it's not a rare disease and that nobody's never heard of, it's in that diagnosis book that you'll get as a coder. So the doctor is going to diagnose you with something every time you go to the doctor and leave. So now this is something to be aware of too, now that you're getting deep inside of this field. Because now that I'm in this field, when I go to the doctor myself, I want to see what you're coding. Because all of these things goes into my medical history. And when you think about medical history, when you're trying to get life insurance or any kind of other insurance, when they want to know your medical history, they're going to pull your records from the doctor. So, start paying attention. Don't just let the doctor see you, write their notes, and, okay, we'll see you, Miss Davis, in 3 weeks. I want to know what you coded it as. What diagnosis or what disease did you put that I have? So, no, I'm in class. No. So, every time you go to the doctor, there's going to be a diagnosis that they're going to diagnose you with. You're not going to leave out there and if you go in for left hip pain, if you go in there for left hip pain, you're not going to come out and they're going to say, oh, I saw her today, she had left hip pain. They're going to diagnose you with something. So start paying attention what's on your medical record that they're diagnosing you with, because that's going to follow you. Always. Because you can dispute it and you can be like, no, I just came in for a fever, but I don't have corona. They've been messed around and I'm going to tell you one thing that I've been seeing lately, because I have to code a lot of corona charts. Now, undoubtedly, the corona is real. I'm not saying it's fake. It's definitely real, But the thing that's funny about it, and I couldn't put my finger on it at first, and what's funny about it, if I read a patient's chart, and if they have fever or whatever else, I have to code it as corona, even though their test isn't back yet. So they're displaying all of these signs as corona, but if their test isn't back yet, I don't want to code it as corona, because that's just making it another confirmed case, and you might just got the regular flu. Or you might just got a virus from your son or something like that. But just what's going on now, if you have all these signs and symptoms, and if you've been around somebody, then I automatically have to code it as corona. So.
Wow. So are they getting paid more for their code or something? Okay. Okay.
You know, so a lot of things in the healthcare field. That's why I was, really pushing it, because a lot of things in the healthcare field is about money. That's why it's never going out of style. That's why it's gonna always be in demand, because you can't think of any other field other than technology and computers that's getting the same money, if not more, is medical care. Only two: technology and medical care. You know, because anything can pretty much fall up under their umbrella. So with this COVID and all this and every other thing, it's a lot of money in healthcare. So diagnosis. So think about it. Every time you go to the doctor, anything wrong with you, they're going to give you a diagnosis. So ask them, what are you diagnosing me with? So you can know what codes are going on your medical claims. Okay. So an acute, the next word is acute. An acute condition has a rapid onset, a severe course, and a relatively short duration. So anytime you see the word acute, that means it came out of nowhere and it probably won't last long. So the opposite of those words, okay, I got it down here, is going to be acute, and then on the other end of the spectrum is going to be chronic. So if somebody has a chronic health condition, that means they're going to have that for a while, over a long period of time. They've already had it. So if somebody have an acute situation, that means it happened real quick, and it's probably going to be gone once we get it fixed. A disease. A disease is a condition in which one or more body parts are not functioning normally. We all know what a disease is. Symptom. We just talked about it. Symptoms are things that let you know that something is wrong. If you got a fever, if you got a cough, if you got a headache, if your hip is hurting. So a symptom is letting you know that something is wrong. A differential diagnosis, also known as a rule out, is an attempt to determine which of the several possible diseases is causing the signs and symptoms that are present. So if you're having signs and symptoms, but it could be 5 different diseases that have these same symptoms and signs. So that's what a differential diagnosis is. That's them trying to rule out what it's not. So if you ever see or hear a differential diagnosis, they're trying to figure out what's wrong with you, because the symptoms and signs you're having could be symptoms and signs of 20 different diseases. So now they're trying to rule out what you have. So we talked about chronic. We're saying that's a condition of long duration. Although such diseases can be controlled, they are rarely cured. So acute, like I said, is happen quick. We can get you fixed up and we can get you on your way. Chronic is rarely going to, like if you have heart failure or heart disease, that's a chronic condition, because once your heart goes bad, it doesn't repair itself. So anytime you have a heart condition or heart disease, that's automatically a chronic condition. If you have kidney problems, that's chronic, because the only time usually you can get your kidneys fixed if you get a transplant and get a new one. Like once it fails, it fails. Liver, any kind of liver issues that you have. Now sometimes it can be acute. And acute mean like today I'm doing fine. Tomorrow I woke up, I went to the doctor, my liver test was low or something like that. They saw what I needed, gave me some medicines. Now my liver levels are back high. That's acute. Okay. Eponym. It's a disease, structure, operation, or procedure named for that person who discovered or described it first. For example, Alzheimer's disease is named for German neurologist Alois Alzheimer's. And a lot of times when you see these names for these diseases, that's what it is. It's named after whoever found it, whoever had it, or whoever described it first. So a syndrome, a set of signs and symptoms that occur together as a part of a specific disease process. Like Down syndrome. If you have the extra chromosome, then you're going to have Down syndrome. So that's when together as a part of a specific disease that you have certain signs and symptoms. And the signs and symptoms of Down syndrome, even if you don't do the chromosome test, all Down syndrome kids look alike. Whether you white, black, Asian, whatever it is, all Down syndrome kids, you can tell they have Down syndrome. Would y'all agree?
Yeah.
Okay. So a prognosis. So a prognosis is a prediction of the probable course and outcome of a disease. So a prognosis means if you come in and you tell me you got, I run a test and I see that you got HIV. So if I give you a prognosis, that's me saying in 6 months, it's so bad in 6 months, then we're going to put you on hospice and it's going to be any day that you won't be, you won't live. So that's what your prognosis is when they kind of predict what's going to go on with you over a period of time, where they give you a year prognosis or for the next 3 months. So that's when they're predicting what your health condition is going to be. So a remission. Anybody heard of remission? Of course, they say my cancer is in remission. Okay.
Yeah.
So it's a temporary or partial or complete disappearance of the symptoms of a disease without achieving a cure. So of course, we don't know, or we haven't heard of any cure for cancer. So we can't say that when the cancer goes away, we can't say, oh, she doesn't have cancer anymore, or she won't ever get it anymore, because it's not a cure. So that's why they won't say she's cured of cancer or whatever. That's why they say, oh, she's in remission. Because since it's not a cure for this specific disease, we don't know if it's going to come back or not. So if we don't know if it's not going to come back, we can't say you're cured or we lied. So that's why we have to say it's in remission. It's gone now. We don't see it now, but I can't say it will or won't come back. So using abbreviations. Acronym. Oh, here we go. Acronym. I'm sorry. Acronym is the word